giving you an opportunity to get the full story from the people who tell it best. This is Mediacom News Leaders.
Hello everyone and welcome to Mediacom News Leaders. Thanks for tuning in. I'm Carol Kelly. Joining us today from the Alzheimer's Association, we've got Melissa Pence. Melissa, welcome.
Hello.
So talk to us a little bit about Alzheimer's disease and the fact that it doesn't discriminate. It really can hit anybody, anywhere, anytime, and minority populations might be at the greatest risk. Tell us about that.
That is right. So currently we have 5.7 million Americans that are impacted by Alzheimer's disease or related dementia. We do know though too that our minority populations are at greater risk than their white peers. For example, the African American population is twice as likely to develop Alzheimer's disease or related dementia than their white peers. And why is that? You know, we kind of look at why some of those factors may be. Minority populations tend to be higher at risk for cardiovascular disease and diabetes as well. And we know, for example, that what's good for the heart is also good for the brain. And so being able to eat healthier, exercise, help maintain that healthy lifestyle are some factors that we can help do to help prevent some of that.
Why is it though that this isn't, it's underdiagnosed basically?
Yes, so Alzheimer's disease oftentimes is underdiagnosed. And the reason why is we find that people are not seeking the help from their doctors as soon as what they may need to. So for example, they might just look at it as normal aging, but in fact there may be actually some other factors that may contribute to that, to their forgetfulness and such. So particularly then if you take amongst the African American population too, their access to health care may be less than their white peers as well. And so not being able to have that access to seeing a doctor more readily can also impact that underdiagnosis. And in fact, you know, by the time that we are finding, serving those populations as well, they're further along in the disease when they get that diagnosis than maybe their white peers as well.
So let's talk about diagnosing this. What are the sites and things to look for?
Sure, so with Alzheimer's disease, some of the things to look for are forgetfulness, but think about, you know, misplacing some of those things. You know, is it at a point that the person is not able to retrace their steps to where they place something? You know, are they able to reasonably think and discuss some things in that aspect? There may be a loss of words as well. You know, are they finding difficult time writing or finding the right words for some things too? Or even performing some of those daily tasks that they were so readily able to do, you know, whether it was a hobby that they enjoy that they no longer enjoy, whether it's gardening, baking or such, and all of a sudden there's that lack of interest. Socialization too, we find, it could be a factor as well. So are they starting to remove themselves from the social situations that they were in? And maybe it's because they're starting to see changes within their own self and they're not comfortable communicating with their peers.
If some of these symptoms seem familiar, where could they go and learn a little bit more or pick up a phone call and call?
That's right. So they can contact the Alzheimer's Association. They can find us on the web at alz.org, or we have a 24/7 helpline as well that's answered by master's level clinicians that can help navigate and answer some of those questions. That number is 800-272-3900. We also have a number of events too that they can get involved in the community. In fact, in April, we have our largest education conference that takes place in the state. Our BrainWorks conference is April 25th, and they can participate, learn more information about the Alzheimer's Association there. They can also participate in some of our events that we've got going on as well. We have a golf outing that takes place in May in the Cedar Rapids Market. And then we also have a Reason to Hope Luncheon too, that's in April in the Cedar Rapids Market. In addition, we have a Longest Day, which is a do-it-yourself event, so people can organize whatever activity it is that they would like to do, and that occurs in the month of June. And they can contact the Alzheimer's Association to learn more about those details.
Lots of events happening that you just mentioned. Again, where should somebody learn a little bit more about that and get involved?
Yes, so they can contact us at 800-272-3900 or alz.org.
Great things that you're doing in the community. Thank you so much for joining us, Melissa.
All right, thank you.
This has been Mediacom News Leaders, your opportunity to get the full story from the most reliable sources exclusively on Mediacom News Leaders.